A significant milestone in our country's history was when women gained equal rights through the Equal Rights Amendment passed on March 22, 1972. Although this amendment has drastically impacted and changed the lives of many women, our country is still struggling to maintain these rights. Healthcare is an example of that struggle. However, organizations like Planned Parenthood provide numerous healthcare sources for both men and women of all ages, races, and religions. Unfortunately, these low-cost services are overlooked by one of the other less common services Planned Parenthood provides for women, which is abortion. However, if we defund government funding for this organization, we are eliminating the preventative services they provide that have saved numerous lives. Yes, abortion is one of their services, but we need to look past the misconceptions and really look at the truth. We need to focus on the main points surrounding Planned Parenthood that I will be discussing today, such as how it enables women's rights, provides access to affordable health care, and what the negative consequences would be if we defunded it. In order to understand the points I will be making in this speech today, we must first start off by understanding what Planned Parenthood is, why it was developed, and what their goals are as an organization. So an important question to ask ourselves and to know the answer to is, what is Planned Parenthood? On the organization's website, plannedparenthood.org, they explain that they are a trusted healthcare provider, an informed educator, a passionate advocate, and a global partner that delivers vital reproductive health care, sex education, and information to millions of women, men, and young people worldwide. The organization's website page, Who We Are 2019, explains that they were founded on the revolutionary idea that women should have the information and care they need to live strong, healthy lives and fulfill their dreams. No ceilings, no limits. The majority of their services are preventative care, which helps prevent unintended pregnancies through contraception, reducing the spread of sexually transmitted infections through testing and treatment, and screening for cervical and other cancers. Now that we can identify what Planned Parenthood stands for, we can focus on some of the key benefits that the organization provides for people all over the world. One of the most important aspects of Planned Parenthood is that it enables women's rights. Planned Parenthood is an organization that is controversial and very politically involved due to providing access to safe and affordable abortion procedures. However, what many do not know is that none of Planned Parenthood government funding goes towards abortions. Therefore, by eliminating government funding, as many root for, abortions would not be affected, but rather women would lose access to safe, available, and affordable health care. Many overlook the organization's positive services due to their religious and political beliefs, but these should not influence a woman's right to health care. Brandhurst and Jennings, 2016, authors of Fighting for Funding, Values Advocacy and Planned Parenthood's Right to Life, mention a moving statement by President Obama. He said, "You can't deny women their basic rights and pretend it's about your religious freedom. If you don't like birth control, don't use it. Religious freedom doesn't mean you can force others to live by your own beliefs." To conclude this point, Brandhurst and Jennings, 2016, continue to say that Planned Parenthood is working to defend a woman's right to choose. As Obama's statement hinted towards, a woman has a right to her body, and her rights should not be limited due to another's personal belief. We have come so far with making progress for women's rights, but if we defund Planned Parenthood, we would make a drastic setback. Another critical aspect of Planned Parenthood is that it is an essential provider for affordable health care. A huge part of not just women's rights, but for human rights, is the right to affordable and accessible health care. Adams Hillard, 2017, author of Adolescent Reproductive Health Without Planned Parenthood, explains that 1 in 5 women have gone to Planned Parenthood at least once during their lifetime in order to receive health services. Therefore, it is very likely that someone you know has benefited from Planned Parenthood. One huge misconception that many believe of the organization is that its primary service is abortion. However, this is so far from the truth. Brandhurst Jennings, 2016, state that annually, Planned Parenthood provides 400,000 Pap tests, 500,000 breast exams, and 4.5 million tests and treatments for STDs. As you can see in this visual aid, it shows, this was from the Planned Parenthood annual report from the years 2017 and 2018, but it shows the different types of services that they have and the percentage. So as you can see, the most used service that they did was STI testing and treatment at 48.7%, 27.1% was contraception, 13.4% was other women health services, 6.3% was cancer screenings and prevention, and 3.4% were abortion services, with a 1.1% being other services. So as you saw in this visual aid, the most provided services done at Planned Parenthood are ones that are critical for women to have access to, such as breast cancer screenings. Without those, some women might not know they have breast cancer, and therefore it'll be too late once they discover it. Now we can see that since Planned Parenthood provides women with access to healthcare, defunding the organization would also deprive women of this access. One of the biggest concerns with defunding Planned Parenthood is the consequence of women, specifically low income, losing access to affordable services. Many researchers have analyzed this consequence and have predicted the startling results. For example, Adams-Hiller 2017 continues to say that by defunding Planned Parenthood, we are blocking nearly 1.6 million Medicaid patients from accessing preventative care. He goes on to argue that despite popular belief, federal funding is not used for any abortions due to the 1976 Hyde Amendment, which was enacted in order to prevent the government dollars from funding for abortions. Therefore, if we defund Planned Parenthood centers, we are not preventing abortions, but rather preventing the health care, such as reproductive health services, contraception, and STI disease services, as well as cervical and breast cancer screening. Another crucial statistic is that teenage girls are less likely to seek contraception when low-cost options are not available. This then makes them more vulnerable to the cuts in public funding, and therefore this increases their risk of potentially getting a possible abortion. However, out of all groups of women to be affected by defunding, low-income families are at the highest risk. Adams-Hiller 2017 contributes once again to these consequences by supporting that 3/4 of Planned Parenthood patients had incomes at or below 150% of the federal poverty level, and therefore they would need to rely on community health centers that are woefully unprepared to provide reproductive health care in lieu of Planned Parenthood. So overall, defunding Planned Parenthood means creating many negative repercussions that many may not be aware of. In this speech, I explained what Planned Parenthood is, their goals, and their services. I then went on to explain the connection between the organization and women's rights. Then I discussed how Planned Parenthood provides affordable health care. And lastly, I explained some negative repercussions women would face if defunding occurred. So now that you have heard these important points, I want you to think of a woman close to you. Maybe it is your mom, your sister, your significant other, whoever it may be. Think of how the defunding of Planned Parenthood would affect them. Think of one of them not having enough money to go to the hospital or specialist. Think of them fearing that they have breast cancer but do not have access to affordable testing or screening. These are all possible situations that many low-income women fear when they hear that people want to defund Planned Parenthood. To conclude, I urge you to consider how our country is considered the land of the free. Then ask yourself, how can we embrace our freedom when we are trying to be controlled and our choices are trying to be limited, especially in regards to healthcare services?